Did the agricultural revolution cause modern diseases? Imagine a time when humans roamed freely, hunting animals and gathering plants, living in small groups with diverse diets. That was before the agricultural revolution changed everything. This shift from hunter-gatherer lifestyles to settled farming communities happened around 10,000 years ago. It transformed how humans ate, lived, and interacted with their environment. But did this change bring new health problems that we still face today? That's what many researchers wonder. Before farming, humans ate a variety of foods, mostly animal-based with some plants. This diet provided all essential nutrients and kept disease rates relatively low. Archaeological evidence shows that hunter-gatherers had fewer cavities, less malnutrition, and fewer infectious diseases. Their nomadic lifestyle meant they didn't live in crowded conditions, which helped limit the spread of illnesses. When humans started farming, they began growing crops like wheat, barley, and maize. These crops are high in carbohydrates but lack some vital nutrients. Farming also meant people settled in one place, often in crowded villages with poor sanitation. This created a perfect environment for diseases to spread. Close contact with domesticated animals introduced zoonotic diseases, those passed from animals to humans, like influenza and tuberculosis. These diseases became more common because of the increased exposure. Farming also changed human health in ways seen in skeletal remains. Farmers showed more signs of dental cavities, malnutrition, and infectious diseases compared to their hunter-gatherer ancestors. Relying on a few staple crops made populations vulnerable to famine if those crops failed. This limited diet could cause deficiencies and weaken immune systems. Genetic studies suggest that early farmers developed adaptations to handle persistent infections, but these changes might have also contributed to modern inflammatory conditions. As agriculture advanced, especially during the Green Revolution, food production increased, but so did processed foods and refined grains. These dietary changes are linked to modern diseases like diabetes and heart disease. From the perspective of the carnivore diet, which emphasizes eating mostly animal foods, the agricultural revolution is seen as a turning point that introduced many health issues. Advocates believe that returning to a diet similar to what our ancestors ate, mainly meat, can help reduce modern chronic illnesses. They argue that ancestral diets rich in animal foods supported better health, and many of today's health problems stem from the shift to grain-heavy diets and processed foods. In practical terms, focusing on nutrient-dense meats and reducing processed carbohydrates aligns with what our ancestors ate. This approach might help address some of the health issues caused by the dietary and lifestyle changes that began with farming. Understanding how human diets evolved helps us see why modern diseases became more common and how returning to simpler, animal-based eating patterns could improve health.